Well, I think the first thing to say that, thank you very much, Pete, is that when we see a pandemic that's rising, we see an increasing number of cases that are very dramatic. So, for instance, when we were watching Italy overseas, there was a doubling of cases every 3 days. And that meant that when they got to 3,000 cases, 3 days later, there were 6,000 cases. So there was 1,000 new cases a day. Now we have, I think, 3,000 or 4,000 new cases, and we're seeing 400 or 500 increase. Now that's very serious, but it's not on the Italy curve. So even though it's very serious down here, and everyone needs to follow the advice, stay home, wear a mask, we've got to get containment of this pandemic here in Victoria. And I'm glad to say Victoria has accepted the help from other states and territories, and particularly from the federal government, to have more manpower down here to contain the virus.
Do you think the wearing of masks and the fact that they have been made mandatory should have happened sooner?
Well, it's always easy to look at things in hindsight. I'm on an evidence-gathering panel that's been set up by the government, and we have been keeping a very close eye on research as it comes to light, particularly overseas, because you've got to remember, we haven't been dealing with the pandemic in the same way as overseas. There's carnage overseas. There's thousands and millions of people who are affected by COVID. There's thousands, hundreds of thousands of deaths. While here in Australia, we haven't been able to look at the question of masks in Australia because we haven't been able to do the research here. Overseas, there's now evidence coming through that masks do provide an extra layer. And the most important layer is physical distancing. And when you can't physical distance, then the masks assist with that. So as a second belt and brace approach, masks are very important. And I do back in what the Premier is saying about mandatory masks whenever you leave home, because as you know, when you walk outside now, there is a lot, or when you're in Melbourne, I should say, there are a lot of people who are now wearing masks. In fact, everyone I see here in Higgins is wearing a mask, and that's a very clear sign that we're all taking this very seriously, and that's a good thing.
We had a report, our Melbourne reporter mentioned on the top of the hour that so many aged care facilities have now been compromised in Melbourne. Is it your expectation that deaths will continue to rise?
Look, I think that this is what people need to be aware of. There is what we call sort of lag and lead in epidemiological terms. The lead is the case number. The lag, unfortunately, is the fatality rate. So people get diagnosed with COVID. It then takes, if they're going to go down a bad pathway, it does take a number of days and weeks. So there's absolutely no doubt there'll be rises in mortalities. We shouldn't be worried about that well, we do need to worry about that because every single death is a tragedy. But when we're looking at our response, we shouldn't be using the number of deaths rising as whether it's working or not. The most important thing is that our intensive care unit and healthcare workers now have some very good ways of dealing with COVID when they get to the intensive care, so that at the start of this pandemic, people were dying around 75% of cases. It's down to 15% now. So even though it is incredibly deadly and very worrisome, the mortality rates have got very low here in Australia because our intensive care specialists are doing a wonderful job. They're now using steroids, antiviral drugs, and they're also using different ventilation protocols. So that's good news, still very worrying and very concerning, but Australia has prepared its healthcare system to the very best of its possibility. We've got 3 times more intensive care beds. We now have 7,700. That means we need to literally have hundreds of thousands of cases before we're at the point of the intensive care being overwhelmed. Well,
just a couple of quick ones before you go, Katie. There's a Black Lives Matter protest that's planned in Sydney next Tuesday. No, it's a different state for you, but from where you are, should that be going ahead?
I absolutely understand when people feel very passionate about extremely important things, and of course Black Lives Matter is one of those extremely important things, but there are different ways in this COVID pandemic that we need to do things, and protests at this point in time are irresponsible. People need to protest online. There are safe ways to do it. There's safe ways to do lots of things, but protesting in large numbers is not safe for those people themselves or for Australia.
And just finally, Katie, just on the horrific economic forecasts that were outlined by the Treasurer yesterday, and he's going to be talking a little bit more about that today at the National Press Club. What's your view moving forward on where changes need to be made to fire up the economy when we can?
Absolutely. Thank you, Peter. So basically, we've got to make sure our safety net is in place, and we heard about that yesterday. I think everyone feels very relieved that there is a clear understanding that we need to get us through to March. Now everyone's realising this isn't going to be something that's over in 6 months, it's going to be longer. So there's that definite recognition, which we always said we would do. We'd review the process around that support net halfway through that 6 months period. And I think we've now made the next right step where we're tailoring our response, because we had to put a response in very quickly. And I think people are very pleased it's not baked into the economy, because it's a targeted support system to get us off the life support system. But as you said, we now need to start to grow the economy. And I think that's about skills and training and helping businesses get back off their knees by reducing regulation and red tape, and making sure it's easier for them to do business, and to also help fire up those innovative companies, which we're already seeing are doing. They're pivoting to this post-COVID economy. We're already seeing that with different companies moving to supplying different masks where they might have supplied clothing before, or hand sanitizers where they were providing gin before. So people are nimble in Australia. We're innovative. We're very resilient people. So let's make sure our economy is resilient as well by pivoting to this new post-COVID world.
It is going to get worse, though, before it gets better. I mean, the forecast for Christmas is that 1 in 10 Australians won't have a job. Do you think that that's even ambitious?
Well, I think that 1 in 10 Australians not having a job is very, very serious, which is why getting control of the pandemic is our number one priority, and getting it back to where we were, which was containing it so that there was virtually 0 cases in the community, so that we can then open up the economy. And that's where we were heading until we had this stumble here in Victoria. I think the rest of Australia is now opening up. I was speaking to my colleagues in Western Australia, and they were telling me that, life's almost getting back to normal. So there is hope at the end of the tunnel, but we need to move very quickly, and we need to make sure that all Australians have got their shoulder to the grindstone, because this is an all of Australia response.